The Born into Care research highlighted the lack of priority being given to the unborn baby in generic social care teams and to safeguarding within maternity services. The new national guidelines call for a greater specialist focus across the system. And in this film, we hear from some of our partner organisations about their perspectives on the need for specialism and some of the changes that they have made in their areas.
The pre-birth team was established in July 2020. It's a team that was developed without any additional resource. The team itself is a specialist team of team manager, assistant team manager, social workers and family workers that work intensively with families to primarily aim to keep babies with parents.
Having a specialist team has ensured that we've got that close communication. But I think it's also had a ripple effect as well.
We've decided to develop a pre-birth team dedicated working with unborn referrals and pre-birth cases.
There was a real hope that we wanted to develop an expertise in terms of the work that would be undertaken with parents at the pre-birth stage. Once we had established the pre-birth team, that all referrals for pre-birth and unborn babies would come directly into the team, and so they'd have the consistency of being managed by one team manager, having the same social worker that would work with the family through the duration of the pregnancy and beyond.
It's really, the model allows much more time and space for the social workers and me as a manager to make sure that those plans are going to work and that they're in the best interests of the family, and have a lot of confidence in the decisions.
I think working with unborns is absolutely a different assessment altogether in terms of what you would do for a teenager or an older child. By getting involved really early on, so sometimes our referrals come in maybe 4, 5, 6 weeks, we get to build them relationships up. A lot of my experiences in time gone by is that, families have different social workers who maybe do one assessment. You go to the longer term teams and you might have another social worker. It's not like that with the specialist team. You stay with us from, the same social worker from that initial 10-day assessment, and that just really improves the outcome, especially when working with, families with really complex needs. They're not telling the story time and time again.
As soon as a parent has been in to see a midwife booked in, or if there's another professional becomes aware of somebody being pregnant, we would accept the referral into the team at that point and work with the family intensively. The model itself is really focused on timely intervention, timely assessments, timely care planning, making sure that we have absolutely no drift and delay in terms of our decision making. We're being very brave, I think, in terms of being able to change processes and change procedures that we would usually have in place. We have legal advice in place at the very earliest opportunity. We have child protection procedures pushed back a little bit so that we don't have duplication of work for social workers, that the social workers can absolutely focus their time on working with parents.
So in terms of the model, the intervention plan starts at week 16 of pregnancy. So at the point of 28 weeks, there'll be the pre-birth assessment, and we'll make a decision about whether or not we feel we need to have a strategy meeting at that time.
Families know that there'll be an assessment complete when mum's 28 weeks pregnant, and that's not lost in our team. And I think in more generic teams, if you have a teenager who's missing, really high risk, if you have a 6 and 7 year old where you need to issue proceedings, an unborn baby, as much as we don't like to admit it, would go on the back burner.
And as a manager, I've managed a more generic team, and just as the social workers would talk about, those are unborn, so they're not running around at really high risk. They're not, we haven't got bruises, we haven't got that is the issue, that in a generic team, the unborns fall at the bottom of the pile.
When you've got an unborn baby, the baby's not here yet, and I think there is that propensity to think, well, that baby, there's nothing additional we can do to safeguard that baby right now. Baby's not here yet. Focus on the children who are here and keep them safe.
Babies the most vulnerable in society, and without a robust assessment with clear safety plans, I can understand if you're doing that at like 35, 36 weeks, you're not confident in your decision making, and you might be less likely to explore family networks or take risks or, you know, be confident in your decision making, because your assessments come at a time when mum's really heavily pregnant and you're almost going to panic mode.
The model focuses really strongly on front loading and early planning, and so we might initiate the public outline process before we've even started the pre-birth assessment if it's a case where we know that, you know, that those risks are very high, and we want parents to have legal advice at the earliest opportunity.
I think the other aspect of being on in a specialist team is that it's all we're dealing with, so we know the interventions much more strongly, we know the processes much more strongly, and as time goes on, what we're learning about what parents need in order to meet the needs of their children just increases, and it really hones in our focus.
And then the detail, because you yourself have done that like work, the detail that you can then put into your assessments is just, I mean, you can just tell in yourself, you know, the parents can tell, other professionals can tell, like how much you've done with the parents, and it makes that so much more robust, and your reasoning and your planning behind the final plan a lot more detailed and thorough.
By the time we get to a stage where we're at court, we know our families inside out. We're really confident in our decision making.
Before coming to the pre-birth team, I think there was always that kind of question in your mind when you did get to court is, you know, could we maybe have done that? Could we maybe have tried this? You know, have we explored that? Whereas now, if that assessment isn't positive, and you know we know that we need to issue, you well, personally for me, you're going in knowing that that's the right decision.
Jigsaw is a joint health and local authority project, and we support young or vulnerable parents before birth. So we've got a team of 6 midwives, 4 nursery nurses and 6 parenting workers, all based in the same team, all co-located.
The Jigsaw midwives are case holding midwives, so we do provide the antenatal and postnatal clinical care. So as well as taking away the safeguarding workload and attending the case conferences, core groups, we've actually taken 8% of clinical work. So we've released, we've taken our work off the core community midwives. We look every day to see if one of our women have gone in and had a baby. So, we've got quite a strong physical presence on the postnatal ward, going in, supporting the mothers, supporting the staff, being that liaison between the ward staff and the social workers, because, the postnatal midwives are extremely busy, and maybe, they haven't not got that time to sit with mum and do all that supportive work.
The members in the lived experience group, when they were interviewed, did explain that they felt that more experienced midwives give them more of a positive experience than those who were just ticking a box, so to speak. So we feel that we did feel that developing a safeguarding team was the way forward.
I'm probably the best version of a social worker since I've qualified. I'm there to answer the questions, I'm there doing the support, I'm doing the intervention work with them. I feel like I'm actually doing proper nitty-gritty social work.
There's been a real appetite and a real enthusiasm across the workforce, sort of managers and social workers alike. I think everybody recognises the positive impact that this is going to have for children and families, and I think that's been really good to see.